leading up to some of the things that are coming this weekend, I wanted to talk about the infection rates for not only Peterborough, but for our surrounding areas. At present, we have less than 10 active cases of COVID-19 in our area. Northumberland has zero. Hastings, Lennox, and Addington does not have any either. And Renfrew is less than five. In the Durham area, they still have a bit of an outbreak. It is a little bit higher number. And as we go closer to the GTA, it is a higher number. I know that there have been a lot of people who have been questioning the wisdom of why we were continuing with the restrictions in this area when we see so many or such a small number of infections and such a small number of active infections. The reality is when you open up one part of the province, people are going to flock to that area. We are about an hour and a half to 2 hour drive from the GTA. The GTA was experiencing a much higher infection rate than what we were. And if we were to start opening things too soon, what was going to happen was that spread of the virus. We've been very, very lucky in this area because we have not had a lot of outbreaks. Even when it has gone into our long-term care facilities, we have been able to lock those long-term care facilities down, and our death rate is very small. The two deaths that we have, um, both of those individuals had other underlying health issues, and it wasn't necessarily COVID-19 that was the reason for their death. It contributed to it, but it wasn't the sole reason. We've been very lucky, and we need to recognize that. We have a long weekend coming, and I know that there is going to be a temptation for everybody to go out and enjoy the long weekend. There are going to be some announcements by Premier Ford today that will make some people very, very happy. Just reminding everyone, please respect the social distancing, respect some of the things that we have been doing that has made us so successful in this area. And let's continue doing that. We would really hate to be in a position 2 weeks from now where we see a spike of infections because the weekend was nice and everyone went out to enjoy it. If you enjoy your weekend, do it responsibly. We did some roundtables again this week. I had one yesterday with most of our faith leaders talking about how Ontario could responsibly reopen our faith communities. Most of those communities have been doing Zoom meetings or online meetings with Facebook Live to conduct their services. Were there things that we could do at the provincial level to help them with that? And what recommendations would they have once we start opening them to allow for people to gather again in those situations? One of the things that came out of that was that actually surprised me was most of the faith communities have said they're okay with having the virtual services right now. They would like to continue down that path, but if there was any way that we could give them guidelines to responsibly have things like funerals, that they would greatly appreciate that. A funeral is a very difficult time for a lot of family members, and when you're not able to share in that grief, it makes it that much more difficult. So we've taken those suggestions that they've come forward with. We've brought them forward to the province, and we hope to have some guidelines on that very, very soon. Yesterday, there was an announcement about education workers who currently are not overtaxed, let me put it that way, within the education system, and having them go into long-term care facilities. The first workers to do this were actually in Kenora, and they have gone to two of the long-term care facilities in Kenora to help with cleaning and maintenance there to make sure that they can keep those long-term care facilities from having an outbreak. I think this is a great example of how different groups, different organizations in Ontario are working together. Who would have thought 6 months ago that custodial staff, maintenance staff from a school board would be willing to step forward and work in a long-term care facility? So I tip my hat to these individuals who are willing to step forward because they recognize that right now they aren't overworked. and they have the ability then to help the rest of the province and keep the infection rate low. We have a roundtable later on today. Actually, as soon as this press conference is over, we'll have one with commercial landlords. I have Parliamentary Assistant to Finance, Stan Cho, joining us, and we'll be able to work with those landlords so that they can qualify their tenants for the rent relief program. One of the challenges that we've seen with it was that program didn't open for applications until this past Monday, and it was a little bit of an onerous process, a little unsure how people would actually qualify for it. And we want to make sure that all of those commercial tenants who need the additional help have a way of doing it. So we are working with the landlords today to get people qualified for it so that we can give the relief to those commercial tenants. There are about 15 million tenants, and there are about a million commercial places. So it's much more streamlined for governments to work with the landlords than it is to work with the tenants. I've had a number of tenants who have asked, why couldn't we give the money directly to them and they would give it to the landlord? And it comes back to how do we manage it in a way that is very, or the least amount of onerous to get the money out. And the decision was made by the federal government to go through CMHC to have the application process that way, to manage it that way, and to have the money flow through CMHC. Most commercial properties have mortgages on it, and those mortgages are all registered with CMHC. So it made the most sense to try and streamline things that way. I'm going to give a shout out today as well. It's to two groups in particular. St. Joseph's at Fleming is still going through an outbreak right now. They have done exceptional work to mitigate any of the risk from it and to keep people as safe as possible. We're not seeing any spread there. This is a result of the great work that people are doing there. And then the second one is to the Kawartha Heights retirement residents who also has an outbreak, and their staff have stepped up. They are doing everything possible to ensure the safety of the residents there. So I tip my hat and say thank you to all of those individuals working in those locations. I know they're doing everything they can to protect our senior population that is living there. And right now, the great work they're doing is showing.